Welcome back, everyone, to TV5 News at 9. It's time now for Medical Moments with Covenant Healthcare. And joining us this morning, we have nurse practitioner Chris Ader. Thanks for being here, Chris.
Thanks, Blake. I appreciate it.
Yeah, of course. Okay, so today we're talking about AED use and care. Just to get us started, Chris, what is an AED and what is it used for?
So an AED is an automated external defibrillator, and it can be used for treating cardiac arrest. In the community, it's very handy because it's fairly easy to use, and it can reverse the abnormal heart rhythm that's causing cardiac arrest and restore someone to a normal heart rhythm.
Very good. Where can we usually find AEDs in the community?
So in addition to a hospital, first responders carry AEDs, so firefighters, police officers, paramedics all have AEDs. In addition to that, you can find them at malls, shopping centers, airports, schools, churches, all carry them. Sporting events is a very nice place for those to be available.
And TV5. We have some too, so yeah, it's always good to hear. Yeah. What would you say is the difficulty for maybe, someone who's not really a medical person to use one of these? It takes them through the steps, right? Yeah, so an AED, it's fairly easy to use. It's only got 3 steps. Okay. The first step is to turn it on. It's voice prompted, so it tells you what to do at that point. It'll tell you to plug the device, the cords into the device, and then there's pads that'll go on the patient's chest. It actually has a diagram on those pads to tell you where exactly the pads go, and it'll prompt you if a shock is indicated. If that's the case, all you have to do is hit a button and it shocks the person and hopefully restores them back to a normal heart rhythm. If an AED is available, is that pretty much all that someone should do in a situation where someone is going through a cardiac event? Well, CPR would be indicated in addition to the defibrillation. Okay. Usually in most emergency situations, CPR is started first, and then if there's an AED available, you can send somebody to retrieve that and start the AED in addition to the CPR. We always encourage a class so that you can use AED and CPR properly to maximize its efficiency. AED can improve survival rates by 3 times the normal. Very good. If a business or entity has one, owns one, do they have to maintain it, regularly test it? What does that look like? Yeah, so an AED is similar to the forgotten smoke detectors in your house that we don't always remember to change the batteries. So there should be sort of a schedule that you have if you have an AED where you are checking the device to make sure the batteries aren't dead. There's also protocol for testing it as well. So you mentioned the classes or like workshops to learn how to use a CPR. Any ideas on where we can go look for those? Yeah, so American Heart Association has classes as well as the Red Cross. Covenant Healthcare uses American Heart Association in partnership with CMU. So we have classes. We also have classes that are held more for the layperson at Covenant as well. Okay. Is there anything that you want to add maybe you didn't get a chance to say? No, I think that covers the AEDs pretty well. If you have any questions, we do have a couple of links that will go up on that'll help you find where we can set you up with a class. Very good. Chris, thanks for coming in this morning and sharing this with us. I appreciate it. Thanks, Blake. Of course, you're very welcome. And if you want any additional information on the topic for today, you can head over to our hot link section that's on our website, WNEN.com.